Bismillah ar-Rahman ar-Rahim. Dr. Hamza Alsayouf, consultant pediatric neurologist, American board. Today we are going to continue our series talking about epilepsy in children. And today is going to be our fifth episode, and we will talk about a specific kind of epilepsy that only happen in kids. This epilepsy syndrome is called absence epilepsy or petit mal epilepsy, and it usually starts above 4 years old until 15 years old, and there is a different type of the absence epilepsy if it starts early or start late. This syndrome, if it starts before 4 years of old, you need to think about other syndrome like GLUT1 deficiency syndrome. So what is absence epilepsy? Absence epilepsy is basically the patient, while he's playing or talking or eating or whatever he is doing, suddenly he will have behavioral arrest, and he would stare, and he would have a blank, empty look, and he would not react at all. Sometimes this attack might be associated with abnormal movement of the mouth. Rarely he might lose sphincter control, and it is on-off. It lasts 10 to 20 seconds, 30 seconds, then he goes back again, and it happens multiple times a day. This syndrome, it's classically and easily caught by family, and the complaint would come, that all of a sudden, while, for example, we are doing a family activity or while eating, he would stop and he would stare and he have a blank look, and he would not answer or react or interact with us, and after that he would continue as if nothing happened. Now, this called absence epilepsy, on-off. It happens multiple times a day, and probably what the family usually sees is maybe less than 10% of the total number of attacks. This, as usual, when the family comes to us, we usually ask them for a thorough history, a thorough physical exam, any family history of the absence epilepsy or seizure in the family, and we do an electroencephalogram, EEG. This electroencephalogram, the patient has to hyperventilate, deep breath for 2 to 3 minutes, as much as you can, and as much as you can get from kids. And classically, 80% of the attack can be triggered of the hyperventilation, and sometimes that's noticed by family. They say when he's playing hard or running hard, it tends to happen more frequent because it's classically triggered by hyperventilation. We recommend MRI of the brain, but usually MRI of the brain is not needed. We do the EEG. The EEG classically has a 3 Hz spike wave. It's called 3 Hz spike wave. Drug of choice for this kind of seizure is what we call ethosuximide, and it's not widely available in UAE. Second choice is Dibakine, and third choice is Lamictal. Now, Kebra and the other medication, they might have very variable response to absence epilepsy, might have a very variable response to other medication, but classically ethosuximide, Dibakine, Lamictal or lamotrigine are the medication used for this kind of syndrome. Start low and go slow until I reach the maximum dose, or the patient no longer control the seizure, or the patient is completely controlled by this by the dose. We treat him for 2 years and from the last seizure, and then we reassess again by EEG. This is one kind of the epilepsy where once I wean off the patient of the medication, I do 24-hour EEG off medication to make sure that we are not having attacks that are not being caught by the family, and it's subclinical, because if the patient stares off on for 10 times or 100 times a day, that will be a big problem for them learning-wise and interaction-wise with the other. That's a very brief overview of absence epilepsy. Thank you for watching, and wait for us for the second, for the next upcoming seizure episode. Thank you very much, Dr. Hamza Alsayouf, consultant pediatric neurologist, American boarded.